Take a straight line on down, and I was able to preserve a little bit of the muscles here, okay? And you can take your scalpel and just kind of do this to separate the muscles from the skin, okay?
Is that the trachea right in there?
Yes, good job. I was just going to point that out. I have a couple of these. You're going to use these to break open the ribs, or to crack open the ribs, okay? Be careful because they're sharp and they can cut you, okay? So you want to be careful. Then once you do that, you can pull this apart and you can see the organs. Now we're going to start here. Since Nick pointed this out, this is the trachea. So if this is the trachea, what would be right underneath? The esophagus. What's another word for the trachea?
Windpipe.
Windpipe. So what's its function? Air. Air, right? So if we put a hole in here, which I'm going to do later, we'll make an incision, we'll put a straw in, and we may be able to see the lungs inflate, okay? If the trachea is the windpipe, what is the esophagus? What's the function of, yes, it's to propel food into the stomach, right? That's the function of the esophagus. Okay. So let's open this up. And what is this?
Is that a lung?
Yes. On the cat, we have 3 lobes on each side. Okay? Little different than us. But these are lungs, and these are lungs. Okay? If these are lungs, what's in the middle? The heart. You guys, this isn't, I picked the smallest cat. You guys are going to have bigger cats, bigger hearts. So you'll be able to actually pull the heart out, and you'll be able to see a little bit.
And where were the lungs again, Doctor?
They're right here. They're
Those
encasing
things right there.
the heart.
Okay.
Mhm.
Both sides like
So
us,
what
right?
I'll do on your test, I may pull out a lung and have it separate from the cat with a pin, and you have to tell me, you know, what it is.
Okay.
Okay, it's multiple choice.
Okay, and that's what they
Okay.
look like. And they're only on that side, or are
No,
they
they're on
sides?
both.
The other one's like hidden.
Oh, I see. It's
Yeah,
like
they go all the way.
flat,
See, it
so
goes all the way
small.
down.
Like this brown
It's
flap.
deep.
What's this little guy? Right here.
Is that
Starts with a T.
Is that the red,
It becomes fat as we.
Thymus.
Thymus. It's the thymus. And what's the thymus? What's the function of the thymus? we know it's, you know, most active in youth,
Or
right?
immune.
Immunity. What? And it produces what?
What's that?
Thymosin. Thymosin. It produces several hormones actually, but thymosin is a big one. It's also responsible for T cells, right? T cells. Okay, this, and you're going to see it a lot better on your cats because you have bigger cats. What is this going to be? This structure right here. Diaphragm. Very, very good. Diaphragm. It's this right here. I'm going to pull it up. This one right here. It is on the cat. Yeah, it's pretty thin. Okay, so if this is the diaphragm, what is this big organ?
stomach?
The liver. It's the liver. And I kept this intact because I wanted to show you. Does anyone know what ligament this is? This is part of the diaphragm.
Okay.
This is a ligament that's going in to the liver. We call it the fossiform ligament. Fossiform ligament.
Okay.
Okay? Now, if you probe around here a little bit, what is this little guy? Right here. Right there.
Spleen?
No.
Gallbladder, maybe.
Gallbladder. Good job. It's the gallbladder. And what's the function of the gallbladder?
Produces bile.
Well, it doesn't
Stores.
produce it, but it stores it.
bile, I mean, it's
Yeah, and where does it get the bile from?
Liver.
The liver. Very good. Excellent. On your cats, the gallbladder is probably going to have a greenish tint to it because of the bile. Okay? Any questions so far?
So
We good?
that's the liver.
This whole organ here is
Both
the
of those,
liver.
oh, okay.
Yeah, this whole
They
organ.
don't have the tendon. like
Which
we
one?
do.
Right. This whole organ
That
is the
whole thing
liver.
right there is the liver.
This whole thing, all of this, all the
So it's
liver.
All of that.
It's like the
Okay.
All those
biggest
little
part
pieces
of
too.
the.
Yeah, the liver's
It's
the,
almost-
the largest organ.
Okay.
It's
Okay.
it's big. Okay.
Looks like there's 8 lobes.
Yeah,
There's
it,
a
it,
bunch of
it's big. The one thing I did want to mention on the tongue, and you can do this with your cat. You know, you can open him up, open the mouth up. You see these little hair like
Where?
On the tongue?
on the tongue, right on the surface of the
Okay.
tongue. That's the papillae. Okay, that's
Okay.
the papillae, and it's rough on a cat because of cleaning. You know, that's how they clean themselves. Underneath the tongue, what do you think you'll see? We have one too.
The.
I can't remember what that
Starts with an F.
thing is called.
Frenulum.
Yeah.
Frenulum. All right.
Frenulum.
Frenulum with an FR.
FR.
Frenulum.
Frenulum.
Okay. Okay, so now we're at the liver. What is this big guy right here? Yes, that's the stomach. You guys can open up the stomach on your cats. A lot of times you'll see the last meal could be, we found bones of birds and things like that.
Can we tell right now if this is male, or female? Without the-
You can, and I'll show you in a second. I'll show you how you can tell. Okay. What is this guy right here? This is a covering that kind of protects the organs and keeps them together. No, it's called the greater omentum. The greater omentum. This will be a pin. I'll have it pinned inside the cat intact, just like it is now, and I may cut it out and have it separate. But this is the greater omentum.
And what does it
Okay.
do?
Well, it kind of helps keep the organs in place. Okay, the intestines and now, before I move this, what is this guy? Yeah, very
Where?
good. This is the spleen.
nice.
Okay, what is the function of the spleen?
It's part of the thyroid.
Blood storage and immunity, right? For immunity. Can we live without it?
Yes.
Yes, we can.
The liver will take over.
The liver will take over. It's kind of a hardship for the liver, but it will do
Can
it.
that cause a lot of damage to the liver, or do you kind of have to adjust your diet,
You
lifestyle,
have to,
and-
yeah, I always recommend probiotics and things like that. Yeah, absolutely. Absolutely. Okay, let's see.
You can see the gallbladder.
Yeah, but you can see the gallbladder from this side as well. That's the gallbladder. Okay, let's pull this up. And this particular organ that I'm going to show you now, it's very glandular, and it's the only organ in the body that looks like this. It's right here. It starts actually over, it should start over here, and it goes all the way around to here.
The pancreas?
It is the pancreas.
Hey, all right.
Excellent, excellent.
Where is it again?
Well, you,
It's
let me
kind
show
of
you.
just.
Yeah, and it is hard. It starts over here, okay? Starts over here, and it goes all the way over to here. It's
Okay.
the only organ that has this tissue, this glandular tissue.
Okay.
Study it, okay? They'll probably, I'll get a better specimen from one of your cats because you have the bigger cats, but I will cut it out and have it separate as well, okay? So you have to know what it looks like. What's the function of the spleen? I mean, I'm sorry, the pancreas. What's the function of the pancreas?
Insulin.
Very good. It does. It secretes insulin, produces and secretes. What else does it secrete? If it what good glucagon. Very good. So insulin will lower blood sugar. What does glucagon do? It raises blood sugar, so we don't become hypoglycemic, right? It also produces amylase. What's amylase?
It's like an enzyme.
It's a digestive enzyme. What about lipase? It secretes lipase as well. That helps break down fats. Okay? All right. The other thing I wanted to mention about the spleen It's about the size of a fist. Okay, this is very small, but it's about the size of a fist. Okay. What is all this here? Which one? The small intestine. Okay. I'm not going to have you ID anything on the small intestine other than it's the small intestine. Okay. What do we call this here where you can see my finger through the... This is referred to as mesentery. Mesentery. Okay. So we have greater omentum and we have mesentery. Okay. And this mesentery actually has blood supply to the small intestine. Okay, so it's very important. If we, what is this? What do you think this whole thing is?
That's a large intestine?
Yes, that's the large intestine. So what would this little thing be? It's like a C-shaped? The cecum. Yeah, very good. This is the cecum. Okay, so if I have a pin, let's say I have a pin right here. What is it?
Large intestine.
Well, it's large intestine, but what part?
Ascending.
Ascending. Oh, boy, you guys are good. Ascending, because it's going up, right? So if I have one, oh, let's see here. Right around here.
So,
I'm sorry?
do they have the same shape, like ascending transverse, descending sigmoid, for the large intestine?
I'm sorry, say it again.
Does it have the same like shape that they have? Like we have ascending, transverse,
Uh-huh.
descending, and sigmoid. Is it the same thing for the cats?
Pretty much.
Okay.
It's just a little smaller, but
Okay.
yeah, pretty much. So if this is the ascending, what would this one be? Going across. Transverse. Transverse. Does anyone know what happens in the transverse colon?
I know in humans you can have like diverticuli.
Well, yeah, you can.
I
But
don't know about that one.
what normally happens is that the food that we eat, that we digest, in the transverse colon, it will take out the water. It will remove the water from the food, so it will become feces. Okay, that all takes place in the transverse colon. If we follow this colon all the way down to here, what is this?
Rectum or
Descending colon. What happens in the descending colon? It's pretty easy. It basically stores the feces until it's expelled into the rectum. Okay, it's kind of like the bladder, if you will. Okay, the bladder is for storage until it's expelled into the urethra.
When
Okay.
does the descending stop and the rectum start?
Well, you go all the way down, and you'll be able to see, basically it's right in this canal here.
Oh.
That'll be the rectum, okay? All the way down. Okay. So speaking of the bladder, this is your bladder, right here. Okay, and of course the function of the bladder is to store the urine until it goes into the urethra, and then it'll be ready to be expelled. Okay.
Are the kidneys
Kidneys?
Yeah,
The kidneys, we're going to get them in a second. This is one kidney.
Wow.
Okay, that's a normal size kidney, actually. That's about right. Over here, you have this is part of the liver. Okay, right here on top of it. This is your other kidney. Okay. The other thing I want you to be able to identify is, let's see here. You may want to, with your cats, take them over to the sink and wash them off, okay, so that they can get kind of messy. So you might want to rinse them. Let me see. I was trying to find my... Oh, here's one, but it's... I want you to cut out, not cut out, but expose the ureters. There's one on each side. And I don't have very good ureters for some reason. I guess because
It would
she's
be
so...
between the kidneys there?
Yeah, it's going to be from the kidneys on to the... Yeah, see, I don't have... I'll point them out on yours. I can't get a good... This is part of one. This is part of one.
Okay.
Okay. And you'll have one on the other side as well.
You want us to expose
Okay.
those?
Yeah, yeah. So what do you think? This is a male or female?
Would it be
Females,
Female.
maybe?
It is a female. It is a female. And I'm going to show. I'll come around for those that have males. Okay. There's a way to. You'll see the vas deferens on the male. Okay. And so we'll try to find one on the males. Okay. Any questions at all?
Right next to the bladder there, would that be the cat's like ovaries?
Probably. Yeah.
Are you be like sending
Like
out a
a little-
list of the markers?
No.
Dr. Pete? Just
I want
straight
you
up doing
to.
it.
Yeah.
So the pins are basically all the things
Yeah,
that you discussed.
for instance, I'm going to have a lot of cats that are just like this, and I'll have a pin here, and you'll tell me it's the stomach. I'll
That's
have a pin
another-
here, it's the liver.